to mix those two insulins, just to give so patient diabetic will be getting one less shot. But then there are also three factors that we would like to take into consideration. One is that Lantus, or we would never mix Lantus or long-term acting insulin with any other insulin. So Lantus basically always needs to be given by itself. And the peak time for insulin is 24 hours. That's number one. Number two, once we mix the cloudy or NPH or intermediate insulin with clear or regular fast-acting insulin, we only have 5 to 15 minutes to administer the medication. We don't want to wait longer because the fast-acting insulin, or regular insulin, will bind to NPH, and that will decrease the action of the medication, and we don't want that to happen. So we only have 5 to 15 minutes to administer the medication. And number three, we also, and I think this would be the most important one, we also have to check for signs and symptoms of hypoglycemia, because and those may include sweaty, clammy, tachycardia, confusion, or simply if the patient's blood sugar is under 70, we will have to hold the dose and we will let the provider know. Because if patient is already hypoglycemic, we don't want to give them insulin, more insulin. Okay, so basically, so now if everything is good, we're going to go ahead and proceed with our medication administration. So as we said, we have 15 units of NPH and 10 units of regular insulin. So first, what we have to do, we have to get the tube of NPH, and we're going to basically put it between the palms of our hand, and we're going to roll the medication. And the reason why we do this, because we wanted to make sure that the medication, the solution, is mixed well, so that way patient will get all the medication that they need to. And then the second part is basically, since the NPH order is for 15 units, we're going to basically we're going to draw 15 units of air, and we're going to basically inject, or we're going to inject 15 units of air into NPH tube, and then we're going to take the needle out, and we will do the same thing. And the order was 10 units of regular insulin. So we're going to draw 10 units of air, and then we'll insert 10 units of air into the vial, the fast-acting vial. Now, at this point, we are not going to take the needle out. We're going to basically flip the tube, and we're going to draw our 10 units of fast-acting insulin or regular insulin. And then after that, we'll take the needle out. Now we're going to insert the needle into NPH vial, and we'll double check the order. We will take now 15 units of the NPH out. Okay, so at this point we have our mixed NPH and regular insulin. That's what we wanted. Now we're going to basically to administer our medication. So I'm going to use the abdomen patient's abdomen to administer the medication. So where the umbilical cord is, so 2 inches to the side, and we want to make sure that we are not basically poking the patient where that